Yeah, Lydia was,
And there might be
she was online. And
Yeah.
Okay, Brian was excused, right?
Maybe we can call the meeting to order tonight, Health and Human Services. Yeah. Oh my
Oh,
gosh.
you care about me and mine?
And we'll start with the Pledge of Allegiance. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. We have a quorum in the room, and tonight we have 10 resolutions on the agenda. No appointments. I'd like to start with approval of the July 13th minutes.
Yeah, move it.
Second.
Thank you. Okay, if we have a lot of the departments here, if we want to start with the resolutions and then any additional information from the reports, we can certainly do that. Kathleen, do you want to start with the resolutions?
I'd love to.
Of course.
So much enthusiasm.
Okay, so resolutions, the health department has 3 of them. And I believe the order, so we've got, the first one is a request for the department to contract with Nurse Corps for nursing services that would be needed for a preschool age child who has significant medical needs and would need this nurse to accompany them to their preschool program in order to be able to attend that program. And so there are not a lot of agencies that provide this service. And as it turns out, also not only does it provide the service, but provides it in the counties. It's a Cayuga County resident, the child is, but the school is in Tompkins County that the child will be going. It works in both. The particular, like the school itself cannot accept the child unless the nurse accompanies them, and nor can the child make the trip on the bus unless the nurse is accompanying them because of their particular health needs.
We get a motion is getting open to questions.
Yeah, move it.
A second.
So this particular nurse will go on the bus and attend the school day
Yes,
and
right.
drive the bus home.
Yeah, we've been speaking with the nurse will probably go right to the family's home or wherever the bus pickup is, which would be the family's home in this case, every day, and hop on the bus with the child, do the same on the way back, stay at school.
And the Tompkins County is basically, that's where the specialized program was.
Correct.
I did ask Kathleen if she was aware of, with this $66.95 per hour, if there were any reimbursement opportunities for this private duty nurse. And at this point, we are certainly obligated to do it. And you're going to double check whether there is some 59 or any reimbursement for the.
And I'll try to get that before Ways and Means.
Okay, I was just
If
curious.
there's anything more. Yeah, I'm pretty sure there's not, but we'll definitely
Yep.
do a closer look because it is a lot of money.
We have a motion and a second. I get a support for this resolution?
Aye.
Aye.
Okay, all right.
Thanks. So our second resolution is a request to fill either a senior public health educator or a public health educator position. The position vacated in April due to a resignation. Had hired the supervisor for that unit, wanted to give that person a little bit of time to decide what type of position they would like to continue on with, either a senior public health educator or a health educator, depending on, the applicants and their experience. It is something that's budgeted, so we're looking for permission to fill that.
I get a motion,
I'll move it.
second? Second. So the new position would be good with either? Is that what you're saying?
Yeah, we prefer a senior,
Uh-huh.
but we know that that requires experience and formal education of a certain type. And given the challenges in finding personnel, we want to allow ourselves the opportunity. If we found someone who qualifies as a health educator and we don't find someone who qualifies as a senior, then we'd like to hire that public health educator and train them to do so. We budgeted for the senior.
Yeah, okay.
And those particular jobs are set in state regulation for what qualifies for. So we're we don't have a lot of latitude.
A motion, a second,
I'll move it.
all in favor?
Aye.
Aye.
And
With budget modification?
yes, and that's pretty self-explanatory, budget modification. We have so much money from our vacancies that we want to make use of it. So we cannot do any of those changes without having a resolution to allow for that.
I'll move it.
A second.
This particular grant, end of September, goes on the federal fiscal year.
So you have state approval and you have local approval once this resolution passes to
Correct.
move the monies.
Great.
All right, any other questions? All in favor?
Aye.
I mean, yeah, had a few things. I know I put a lot of information about particular seasonal work that's been going on in the report this month. We had it was a good turnout for the Latching Littles. It's Breastfeeding Awareness Month. It was National Breastfeeding. It was a great event that the community comes out for, and it really promotes families and nutrition. So that was wonderful. You'll see a lot of outreach events, definitely ramped up for our back to school immunizations and healthy neighborhoods. We finished canvassing the village of Port Byron and one of the Auburn census tracts. And when I say canvass, we actually, staff literally go out and walk the sidewalks and hang the door knockers. And then some of them, some people who, if they're at home, will come and say, sure, let's schedule something. Other people will call and schedule. And we got more than 55 home visits for June and July. So that's good. That's really good. Really pleased with our lead prevention. As you know, we have the enhanced prevention, they call it the primary prevention. And as a result, the National Center for Health Housing works with those counties, and I want to say there's maybe 19 of us who get this enhanced funding. At any rate, they are subcontractors to the state health department. They made a site visit on Tuesday. Really great visit. They went through programs and policies and talked about things working well. They were really impressed with the partnership with social services that we've had for like the postcard campaign and things like that. They had a few good suggestions how we can enhance our lead task force, which we were grateful for because we need to kind of spark that up a little bit more. And just, it was a great visit. So we'll have a more formal write-up from that, but it was, I think, really heartening for the staff who work in there to realize sometimes you don't see how much you've accomplished, and they really came in with fresh eyes that helped identify how much has been accomplished. I wanted to talk a little bit, I just spoke briefly with Elaine on this. We still have 2 vacancies right now. Well, so I just asked for a fill for the public health educator. But aside from that, we have a junior accountant position that's been open. We have our community health services director position that's remained open. We're trying a different spin in our advertising. I'm really trying to hold out to the nurse for the community health services. So our advertising is now calling it director of nursing. We'll have them call the department, explain what the job is if we can get that. So hopefully it's a little more reflective of the actual job, right? So that's one. The other job, junior accountant, we're fortunate through the contracted agency with the county that we've been able to have someone come in to assist us with some of the routine work that's being done.
That's the half contract you're
That's,
referring to?
yes, that's the Robert Half agency. And we're glad for that, but we want to fill it with a permanent person. We've had no success with the junior accountant position. I'm not telling tales too far in advance, but our director of that division will be retiring a year from, she'll have already been retired a year from now. She'll see us through June and then she's retiring. So that'll kind of be the final swipe of all of our directors, right, in that year and a half. However, we have to start training someone, right? The position that's vacant theoretically would have been that position to assume greater duties, right? And that had been previously. So we really been thinking about it, and we also took a look at the descriptions that social services has and other agents. We looked at a lot of the county ones, and we put together a job description we think would be, it would be higher than a junior accountant, but poise itself to start learning more things to then be able to assume this director of admin services. That's what the division director is called. So we're working with civil service right now to create that job title. What I'd like to do is come back next month with a resolution to request to fill that position, and then not try to get a junior accountant again. It would be an adjustment in salary somewhat, and I'll have all the fiscal impact for that, but it would also be more duties.
See, it's in the union.
Yes, I do see it staying in the union. Yeah, I think that's appropriate.
What are the qualifications for the director of nursing you're looking for? Is it RN?
RN, yeah, we prefer BSN, but legally it's an RN. They have to have some supervision experience. We want a minimum of 2 years supervision experience. But it's a really great job. You know, we're not responding to a pandemic like we were the past 3 years. It's a Monday through Friday job, primarily overseeing our clinical programs and the WIC program. So it can be a really fulfilling job. I think it can be very rewarding. So hopefully we'll find somebody who will like that and be a good candidate for it. And then the other topic I just wanted to kind of bring to your awareness, and you're a little bit aware, watershed rules and regulations. Some of you may have read the newspaper article today, and Elaine has a copy I was going to pass around for people if they had not had the opportunity. But if you read the Citizen and look for City of Auburn, Town of Owasco, it will tell you about where they stand in responding to the watershed rules and regulations as the state health department has responded to them. So in October 2022, you know, after an extensive process via the town of Owasco and the city of Auburn, via the health department, that's the venue you have to take, propose these updated rules and regulations. So the state has taken time to go through them and had some conversations, and they came back with a draft. Thankfully, it is still a draft, right? Because they really decimated it. I don't get so black and white in my conversations too often, but they are worse than the ones we have from 1984. They literally roll back in some areas, the watershed protections. That's for your information. Regardless of the fact that these happened to come out just last week, as a county health department, we are updating we're always updating our emergency preparedness, but particularly we're updating right now our do not drink response. And the scenario that we use for this one, although it could be any sort of contamination, the scenario we're looking at is harmful algal bloom contamination of the public drinking water supply. So that's why I think all of you as legislators had received information. I think we sent it to the chairperson, and then he sent it out to everybody about reminders about how we communicate as a health department, the flyers about anyone who can store drinking water right now in an appropriate container, take it right out of the tap, put it on your shelf, right? That 3 gallons per person per day. We really want to encourage people, if they're not registered with HyperReach, which is the reverse 911, to do so. And you have to register your cell phone directly. It's not necessarily an automatic. It's been a really great experience for us, because not only do we have a number of new staff, you know, a lot of the agencies that we work with have a lot of new staff. So we're revising the phone numbers and the contacts. We're getting a little bit more specific, because we really want the idea that anyone who's in a particular role could go to this plan and say, oh, I don't know that person's name, that's in the appendix, but I know the role that they play, and here's how I can get hold of that person. And it's, there's a lot to it, but we've got some great staff who are working on it, and great input from our partners, such as the town and the city and 911, et cetera. One of the things we are looking to do is have a drill. We're not quite at the point to have that drill, but we hope within about a month that we'll be ready with some of the revisions we've made to kind of do a dry run, so to speak, to drill our communications and how we respond in a more real-time scenario. Because if we received word as a health department, which would likely go to our Director of Environmental Health, Ani Fish, she would let me know and we'd start the ball rolling if there were cyanotoxins above a certain level in the drinking water. Related to that, we know that we had last fall in the raw water tremendously high level of cyanotoxin at one point in time. It was truly an anomaly, but it's showing, we go back and we look at our data over the years, we're seeing the toxin levels double over the years. Our Director of Municipal Services from the city said that the city is really working to try and find a way to test what is the capacity of the carbon filtration system, right? What is the max? Because we don't know what the max is that can't. But so far, everything's been good, and we're very grateful for that. But we need to be prepared, and because the contamination could be something other than cyanotoxins. So we're working on that. We would like, there's a role for legislators in that, right? There's in certain roles, and certainly for the chairperson when there is an emergency. So if there were do not drink, clearly it would be such a burden for the community, right? And I just want to run down the list. I asked one of our staff members, just so we know the breadth of the people, the towns and villages that are impacted by public water. So the public water that comes from the town of Owasco serves those in Owasco, the town of Owasco. And there is part of the district of Fleming, the town of Fleming. From the city of Auburn, it's the city of Auburn, the town of Aurelius, the town of Brutus, part of the town of Fleming, Water District 6 on the west side of Fleming, the town of Mentz, the town of Montezuma, the town of Senate, the town of Springport, Water District 2 on the northeastern side, the town of Troop, the village of Cayuga, the village of Fort Byron, and the village of Weedsport. It's a lot of area, it's a lot of people, and we hope we will never have to truly execute this, but as part of preparedness planning, we are working toward having our plans up to date, and we'll practice them.
Are you hoping some of us will consider participating?
Yes, I think it would be great, whether you have an active role or whether you're there just to watch how it rolls out. And it would probably be about 2 hours, because those first 2 hours would be the most activity, right? I mean, into communication. That's what we're really testing, the initial communication process. We're not going to test having a joint press conference, but we're going to test, hey, partners, can you set up technology for that in the next hour? So it's good. It's good practice for us, and right, we hope for the best, prepare for the worst.
Lydia has her hand up.
Thank you very much. So I'm glad that you mentioned water and the town of Troop tonight. I haven't received confirmation, but are you aware of a water break on the county water line that has been in excess of a month?
I myself am not, but I can certainly look into it, Lydia. I have to think if there were a break, there'd be a boil of water that's going on.
And that was my question. I would think that anything at that level would involve your department, and I would have heard something from you. So I would appreciate if you do, and if there is anything that I should be doing to be actively involved in whatever the situation might be. This was something that was brought up in the Town of Troops meeting last month, was a week or two. And I was very surprised by it. So
There is a mobile home park that I know is on a boil water order, but I don't know the location of that, but I'll find out what's going on. If it's in the Town of Troop, you've heard? I'll find out.
was on the county water line in the Town of Troop. I
Okay.
don't know about what those line zones are.
Sure.
But yes, anything that you can do to help me with, and then let me know what I can do to help.
Great, I will.
Who would the notice have had to come from? If there was a
Town.
break,
The
the
town.
town would
water-
town
the
is
water
responsible to
Yeah.
notify the health department?
Correct. And the water operators are really, they know the significance of their jobs. So,
But
but about communicating.
And said that the county's responsibility. That was the response to the resident. Then where would that information come from?
So I'm sorry, I couldn't hear you some of the time, but if it's through the county water and sewer authority, they would notify us also because so let me see what I can learn and I'll find out.
Thank you very much for your help with this.
Sure.
Just a comment and a question. When is Eileen officially done?
She's done.
She's done. She's officially retired. Okay. Next is a comment at the full meeting on the 22nd. I will be giving you a proclamation, you or Deanna, for National Breastfeeding Week.
Yeah. I'm
Just
sorry
want everybody to know that.
that Tanya from our WIC office, we really like to do this. I mean, breastfeeding is such a great nutritional
Mhm.
option and it's great for the health of children. The health department, nursing side, as well as WIC are involved with it. And Tanya ordinarily would come, our WIC coordinator, but she's not able to that day. So
I think last year all the
Happily
staff came, if I remember right, pretty much.
they
all the
might have,
staff. Yeah.
they might have.
Okay,
That's great.
thank you.
Thanks. Thanks.
Thanks.
Okay, Christine?
That's fine. We have 4 resolutions today, and if you want to talk about HH4, HH5, then I'll ask for motion for both of those because they both seem to be filling budgeted vacancies.
Okay.
Okay,
HH4 is for us to fill 2 caseworker vacancies. We had 2 caseworkers resign, that are in the foster care preventive area last month, so we're asking to fill those.
okay,
And HH5 is for us to fill a senior human services examiner. She is a worker, long-time worker in the Medicaid unit who was retired.
Can I get a motion and then we can have any discussion?
A motion to bundle 4 and 5.
A second?
Okay. Is this the help? Is the senior examiner part of that?
No,
No, because just the entry levels,
that's right.
human
Yes,
services.
human services examiner is the only one that we can do help with.
I have a motion, a second for HH4 and 5. Oh, you have a question? Sorry.
I just wondered how many, beside the DSS attorneys, how many DSS caseworker, et cetera, sort of openings we have right now?
I was going to talk about that after. We can talk about it now.
Yeah.
Right now, we have 6 vacancies of caseworkers. So that's 24%.
2 months ago, you had none, or 3 months. Remember, we all clapped and then,
And then I've been back every month asking for a couple. Yeah, so it's, I was going to talk about that. 24% down in caseworkers, is a lot. And they're, I don't know if you want to talk about it now or want me to talk about it after, kind of some of our thoughts.
let's get through the resolutions then you can. Okay. I have a motion, a second. All in favor for 4 and 5? Aye. Any opposed? Okay, great. 6 is a contract with Community Action to do
Yep.
the outreach.
Yep, so this is a contract that we have had for years with CAP to do the alternate certifier for HEAP. HEAP season starting in September, runs through April. They help us greatly with taking in applications for folks that are applying for HEAP. And meet with folks, help them go through paperwork, help them get the documentation they need to determine them eligible for HEAP services, and process that paperwork over to us. And then we have some things that we need to do on our end, but definitely very helpful. They have a team of people that get started in September.
I'll move HH6.
Thank you, second.
All in favor? Or any questions?
Aye.
Aye.
And then H7 is to renew the contract with Northwoods.
Yep, so we're looking to renew the contract that we have with Northwoods. We've had the contract with Northwoods for a few years now. It's the technology solution that helps caseworkers have the ability to access pretty much all of the documents that they would necessarily have in paper that they would need to, bring information to a family about services and supports, fill out referrals. They can access case information in the field very quickly with Northwoods. We have started to not keep paper records. A lot of the paper that we have is stored right in Northwoods electronically, and then they shred the paper. So it's been very nice to cut down on the bulk of, humongous files and paper referrals and things like that.
I'll move this.
Second.
Questions?
This is annual.
Pardon me?
It's an annual.
Annual contract.
Right.
All in favor?
Aye.
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 Okay, go ahead, Christine.
Yeah, so some of the points that I wanted to talk about tonight were really around staffing concerns and vacancies that we have. We did interview this week for the attorney position. And hopeful, that maybe we'll have something that ends up working to get someone hired for attorney, but that's one out of, the two social services attorneys, and then we still have the supervising social services attorney position. So still working to fill those. The director of fiscal management for DSS, we did get a couple of applications. We interviewed a man this week, and we're talking about bringing him back in for a second interview. So I'm hopeful that we can continue that process and explore this particular candidate a little bit further. But in addition to doing that, we're also talking still about, does it make sense to use Robert Half? And going to talk to Diane about that perhaps there's something that Robert Half can do to help support the accounting unit of DSS while we are seeking, and looking to fill.
Yeah.
It's been going on for a long time that we haven't had someone. And then also John Marshall put in a call to a headhunting firm that she's familiar with, and they're going to get back in touch with us. We're going to explore whether or not they could help us do a search also for this fiscal position.
Your concern before was, although, you have to deal with what you have to deal with, there is a matter of a test, but it's still worth the effort to try to see if they can
Oh, yeah.
identify candidates, correct?
Yep. I think so. And it would be probably a couple of years before that someone would be here before the test and the test results would.
Okay, so that's the other side. I mean, they would
Right.
have a
Yep.
significant time on the job
Yep.
before they'd be required to
Before-
test.
Yep,
And then they might have two opportunities
right.
if they're,
Yeah.
yes,
So
okay,
hopeful there.
okay.
On the services side, we do have the 6 caseworker openings right now, and that's just difficult to manage, being down 24% of the casework staff. We have 25 caseworkers, down 6. And then we have the senior caseworkers and the supervisors. So, everyone, I think I said this before, is pitching in and helping and trying to, do their best to cover, but it is not something I think that's sustainable to be down.
I think we asked you before if you thought it had to do with salary, and at one point you said it didn't, but it has to do with the difficulty of the position or the amount of
Mhm.
jobs that are open, all the
Mhm.
above.
I think it's all the above, and I think I have more come to the conclusion that I think it may have something to do with salary. I think, what's happening at this point is we're losing workers to the state.
Mhm.
We're losing workers to our own county, other departments in the county.
Mhm.
And, I think I want to like take some time to collect some data on where people are going,
Mhm.
that we know, it's not retiring, as much anymore. It used to be, but where are they going and why do we think this is happening, and bring some data back. I talked about, working with HR to see if there's something that we need to be looking at as far as the job. Is it where it should be as far as pay? I don't know. I think when you have caseworkers that are, have been here, not very long, it is incredibly expensive for us to be training them. They're going to a training program that really is kind of an academy-like program where they're going for 6 weeks away.
Mhm.
And in between, they're back back here in the home county, like working on required work to get through their training program. And they're honestly not at a level of being able to function independently on cases for, well over a year. So when we're losing workers within that window, we haven't even gotten them to be at a point where they are self-sufficient. Nobody's ever like 100% on their own. There's always supervisory support, but really just having a feeling of like, I got this. I know what to do when I go in the field. I understand like my job. We're losing before they even are at that level. And now we're losing veteran staff. People that have been with the department for a long time are leaving to go to other departments because the feedback is that the job is just very difficult. And I think that's true. I think it is a difficult job. The things that have to be investigated, difficult situations, we have, caseworkers that are investigating abuse and neglect, sexual abuse. We have caseworkers that investigate fatalities with law enforcement, right beside law enforcement when children die. And those are very difficult things to, for caseworkers to do. And I think that it's vicarious trauma. I think that they do definitely carry a lot of weight, of the situations that they encounter every day. And when you add on the stress of not enough workers to help support the workload, I think that it even becomes more difficult. So I think that it is a big concern.
Is there upcoming meetings with the union regarding certain levels of employees?
There
We
is.
just don't know which titles,
It's September 8th. We're meeting with the union.
and they wanted to bring forward some discussion about retitling certain things or regrading things.
There's 4 or 5 departments. I would talk to Diane, as you said, and maybe at your department on the list.
Okay. Yeah, we have had some conversation about that, like trying to figure out like what makes the most sense. It doesn't make sense to continue to have this, revolving door. It doesn't for the staff that are here, for the families that we work with. I mean, it definitely isn't the best situation. We have a lot of work. I mean, there's right now, we have 84 families whose children are in foster care or placed with a relative. Plus we have about 60 preventive services cases. Most of those are court ordered. So those are cases where, we've been court ordered to continue to work with a family due to an abuse or neglect situation in the majority of those 60. So those cases are all pretty intense. They have families that have complex, needs and issues. A lot of them relate to substance use and mental health issues that are not easy to get through quickly. So, I mean, it's something that, takes a lot of work and a lot of effort to continue to help support families that, need, these very important services. But I think that, sort of lends itself to why the work is so difficult.
In the 84 families, there's certainly a higher number of children.
Yeah, there's 120
Mhm.
children right now that we serve in foster care. And then it's the 84 families are those families plus the ones that are the Article 10 placements. We have over 1,200 cases of child protective reports that we investigate each year that come from the state central registry. So that's a high number. That's a number that hasn't gone down over time. It continues to creep up. We used to be under 1,000 and we never see that anymore. So I mean, that over 1,000 cases, 1,200 cases that are being divided out between the staff that we have when you're down 24% and trying to manage the workload, that's something that can definitely impact, the workers feeling like they have the time to spend with the families and do the work, do quality work. They want to do a good job. So I think that some of that also comes into play when we talk about how they're feeling about, their job and job satisfaction. So that's really on the staffing, situation that we have. On the homeless, service provision front, we're still serving over around 110 individuals and families for emergency housing. So those are still numbers that are well above what we've seen in previous years. Seeing an increase in families that were having a hard time moving out of emergency housing for the mere fact that there doesn't seem to be low-income housing to meet their needs in the county. So they're staying in emergency housing far longer than we would like them to.
Just a couple of comments, and I want to thank Chris and certainly Jen for working with our county attorney's office on the state of emergency. They needed all kinds of information from your office, and we appreciate you working with you and Jen
You're
both.
welcome.
There is still a state of emergency. I just signed it again yesterday for and I hate the word migrant. I've always hated the word migrant. To me, it's degrading asylum seekers. And Rich has been working on it for 6 months now, 4 months, updating it all the time, working with the other counties, answering things from New York City. And so it's been a process, but it's working, and I want to thank you both for that. Next one is, last time we talked, I think we had 80 that we were taking care of. Now we're up to 110 again. 80
Did I say?
individuals.
I don't think I've said 80 and maybe, I
I thought
don't
it
remember
was.
that number,
All
but
right.
we're at 111. I think we were down, we haven't dipped under 100 in a while.
Okay, I was wrong then.
Maybe, but it might have been individuals,
That could have
80
been.
individuals,
That
but
very easily.
all
could have been.
total,
Okay,
between families and individuals, we're up over 110.
and that's in the summer.
Yes,
That's going to go up dramatically when the weather changes.
Yeah.
That's a lot of people. Another one, a director of fiscal management. I've been talking to some people. What is the salary on that? Do you know right offhand? I mean, I could find
I
out
can't
from
remember.
Diane.
Jen's on. Jen? Is she on?
I don't,
It's a great.
yes, she is. It's okay. I can find out through Diane. Nothing.
Yeah, there's a range and I can
Okay.
let you know.
73 to 84.
It's a grade 6.
Yeah, 6.
Grade 6?
Grade 6 non-bargaining.
Yeah, 73 to 84.
83 to 84. Thank you, Jen. And what else I got? I think that was it. That was it. Thank you very much.
Lydia?
Hi, thank you very much. I just wanted to talk about the issues that we have with the homeless population and let you know that DePaul Properties is now receiving applications for the Port Byron Apartments. It's low-income housing. The occupancy is expected to begin on or about September 1st, 2023. I'm not sure, Chris, have you received any information from DePaul Properties on this yet?
We have.
Okay,
Yeah, we have. They contacted me and I know that they've contacted, I passed them on to talking with the folks in temporary assistance.
excellent. Thank you. I hope that the folks there find it helpful.
You know, it may help some of our folks. I think that some of what is difficult is some folks don't have the backgrounds that are preferred by DePaul. So they have things that rule them out of being able to be housed in their facility, which, no, they're not the only ones that have those restrictions, but it definitely will be helpful for families to do qualify.
Thank you.
Elaine, one more question, last question, I promise you. The attorneys, I know that you were talking to 2 different attorneys at one time. Second attorney didn't work out, proposed attorney?
Right.
Okay,
Well, it hasn't applied.
okay.
So
And the first one, when will you think you might know if there's an exception?
we interviewed this particular person earlier in the week. And so we asked for some references to come in.
Okay.
So we're going to be checking references and then hopefully those are sent in timely and we already actually have reached out
Good.
again to say,
Good, good.
but thank you for coming. And we'd love to, see your references.
Well, our 4 attorneys can certainly use a break, that's for sure, but
I know.
thank you. Thanks, Chris. Thanks again. Good job.
Thank you.
So I have one resolution and it is to one of our psychiatric nurse practitioners will be leaving at the end of October. So it is to fill a budgeted vacancy when she leaves for
I'll move it.
nurse practitioner position.
Yeah, second.
Just wanted to get ahead. Oh, go ahead.
Yeah, that's the one for the staff psychiatric nurse, is that the one?
Nurse practitioner, yep.
Will that person be working with the sheriff? Is that what one reason we're doing this?
So she is leaving to take another position somewhere else. So this is going to be to fill behind her position. But next month, yes, I will be bringing a resolution forward to adjust the stipends for the jail work and essentially hopefully have 3 providers in the jail instead of the two that we had. This nurse practitioner was one at the jail, so we're going to be moving that stipend to somebody else when she leaves to do the jail work as well.
You explained to me that this particular staff has over 300 cases in the mental health clinic.
Yes.
So they need to meet that need and then.
Yeah, the jail work is,
Stipend.
is
Okay.
outside of clinic work.
Won't that position be harder to have to fill?
I don't know. We'll see. I mean, I think those salaries for our nurse practitioners are
Pretty
pretty
good. Good.
And we haven't had too much trouble filling them. So I hope we have a couple of people that have already expressed interest. So
Great,
that
great.
just from networking and people knowing our other nurse practitioners. So hopefully, cross our fingers that won't be as hard to fill. But this will allow us to be able to offer the position. And I know they'll have to give notice to their employers, so it's a little bit of time. So I'm glad that she gave us that much of a notice.
Great.
Did we have a motion in a second?
Yes.
Yeah, okay, all in favor, filling the,
Aye.
any opposed?
And then I just provided a couple updates. I had our mobile crisis team pull together just some numbers just to give you a good idea from April till now, how many crisis calls we've had and sort of divided up on some demographics there. But I will say they've been going out and doing a lot of in-service trainings with different community agencies and going to community events to let everybody know about the mobile crisis team being available during the day. And I will say, since they've done that, we have been busy. Mobile crisis has been busier over the last few weeks since they've started to do that. So I just wanted to provide you with some numbers there.
Is it still 911 that generates this, or it's a direct number too?
So this could come from a variety of different referrals. So
No, they don't have to call 911 to get
no,
mobile
they do
crisis.
not have to call 911 at all. They can call directly to the clinic and request
Okay.
mobile crisis. Yes.
And that's what you would prefer them to do,
Yeah, I mean, I
unless
think
there's
if there's a true emergency, then of course call 911. But I think if it's about a mental health crisis that somebody else can respond without law enforcement, we would rather have that happen. And then just some updates from the Healing Cayuga and the BJA grant that we have. Overdose and fatality levels are low and almost to where they were pre-COVID, which is very good news. I know the last 2 weeks we've had 0 suspected overdoses, which is huge. And then just how many Narcan kits have been distributed over the, up until now this year. Definitely surpassed numbers. And I think we're going to be surpassing numbers than we kind of originally had, projected for the year. Maybe even almost double that. The 911 diversion program will be starting on September 1st. And that's when 911 calls come in, that they're going to be diverting mental health calls to 988, and then in turn being able to refer mobile crisis if law enforcement isn't required for those calls. It's another way to refer to mobile crisis without needing law enforcement.
who staffs the 988 to do
The state, it's a whole state
Oh, the
initiative.
state
There's-
does it,
there-
and then they'll be the ones.
Yep, they
to make the
provided funding to all the
determination.
different call centers over the
Yep.
whole state for the regions, so we're assigned a region. And we
Okay.
have a call center that will take care of that. They've been in our meetings with our 911 center and with the grant.
And they'll take the responsibility to say, this doesn't need to be 911,
Yes.
this can go a different direction.
Yes, yep. And 911 has kind of a flow chart that they're gonna be using to refer to 988 or not, have law enforcement respond. So,
Dr.
We kinda-
Bucket talked yesterday about the fact that his business is a lot less with not all the overdoses. I mean, he's seeing it from a coroner standpoint and talked about it being at pre-COVID level as
yeah,
well, so
yeah,
that's
no,
great.
that's huge. And then there's some money that's in that grant for some housing assistance. So we just started kind of talking about that, what that's gonna look like, what the criteria will be for that. That will be people coming out of jail or out of treatment to be able to provide a security deposit or a first month's rent so that people can kind of, if they need some assistance in that way, that we can help them with that as well.
Right, Dave?
Yeah, Lauren, are you having trouble staffing mobile crisis, or are we doing better with that?
So mobile crisis is staffed by, we have 3 therapists in the clinic that So there's 3 that rotate. So 2 of them have 2 days a week, and then the other one has 1 day a week. And then the other part of the time they work in the clinic.
Okay,
And then we fill the full-time position to take their cases. So right now, no. I hope we send it that way,
I
but
know we had a problem a while ago, but that's.
yeah, we're fully staffed right now,
Great.
but that, obviously that can change at any time, but
I just want to thank you and the sheriff working together and other people for starting this mobile crisis. There's not many places in the state that have it. You guys have done an outstanding job. with
thank
us.
you. Yeah.
So
I think
congratulations.
they enjoy that work too, to
Yeah.
do something different as well. So,
Great job.
Thank you.
Thank you.
Thank you.
Yeah.
Okay.
And then Deb, and then Lydia has something to say before the meeting closes, correct? Lydia?
I think
Thank
she,
Yep, yeah.
So I just have one resolution. And this is actually one of those nice ones where we are bringing in revenue by contracting with one of the managed long-term care companies. And they contract with us to provide meals for their recipients and then reimburse us for that cost. So helps our program.
Okay, I'll move it.
I'll second. Any questions? In favor?
Aye.
Aye.
And then I'll talk about my other common thing. So you do know that we've been short the fiscal person. We do have a part-time person helping and she's doing a great job. But one of the things that's kind of come about over the last 4 years is that we received a few $100,000 of COVID money, which was great, except and for our department, it was a whole lot of money really quickly. And it came with parameters, but the parameters were on some of them were waived during the major disaster declaration. Just a lot kind of going on all at once. A lot of new programs and services that we had to do during COVID. Long story short, during the process of accepting money in 20 and 21, all the COVID things going on, people working from home, we're now at the end of that process where we are trying to close out some of those grants and optimize all that money, make sure that we've spent it wisely and appropriately. And particularly on our meal program, because the cost for our meal program has gone way up and the demand has gone way up. So as a result, we've determined that we just need to make some adjustment in the way that our budget is to be able to fully optimize the funding that we can claim on these grants. So I'll bring a resolution next month to actually pull that together and do that. But it's a really important resolution because without it, we wouldn't be able to claim all the grant money available to us. And also our nutrition fund, our nutrition program is really, with the end of the COVID money, if you remember, some of you before COVID, we had to come to the ledge and ask for some extra money to fulfill the demand of our meal program. Well, you can imagine since COVID, more people are now eligible than ever. People are still looking for the service. The COVID money has been somewhat masking the growing need and the growing cost. So I just also wanted to put that out there because we'll be looking at that, whether it's this year or whether it's in the budget season. I wanted to let you know ahead of time that the COVID money has been a big cushion and it's masked some big increases in expenses. So unfortunately, we'll be back to reality.
Which means there could be a request that the county do some supplementation to keep the Meals on Wheels program at the level it's at.
Possible for this year. I think we're gonna slide in just perhaps where we need to be by the end of this year. We have stepped back a little bit with enrolling people in the meals program. We've always had a waiting list. The wait list is a little bit longer now, so we can kind of manage the funds. So it's a possibility, yes. Pretty certain it'll be an ask for the budget season.
I'm not the only one here. I just want to thank Brenda and her staff. We had a little parking problem over at Brenda's place.
Did you solve it?
We solved it, yeah. Everybody in the world's not happy with it, but we solved it. And I want to thank Brenda and her staff for understanding, and Gary and Shireen for working together with us. Hopefully someday we can make it better, but for now, thank you very much for understanding. And your staff, thank you, please. Thanks, Brenda.
Any other questions for Brenda?
Thank you.
Thanks.
Sorry, Deb, last but not least.
the whole.
She said she has young kids, she doesn't rush to get home. It was just canceled, so I'm afraid. I have one resolution that I'm bringing back after 6 month tabling. It is for the authorizing the youth bureau and the director and the county legislator to enter into an agreement with HELPRA. If you have the resolution in front of you, there is an update to that. HELPRA is now a not-for-profit organization. They have been granted that, so they're no longer HELPRA LLC, they're HELPRA Inc. So that's one thing that we would have to change on this resolution if it were to pass with the law department, being that they're now a not-for-profit organization. Just a few updates on this actual LG Safe Place program that is under HELPRA Inc. I was there today. I did a visit. I met with Wally Myers as well as Sherry Campanola, who's on their board. They do have a board of directors of 5 individuals. They're doing a wonderful job. I've heard about the space. I went there. It's very large. They have a large television set, furniture, musical instruments, foosball, ping pong tables, a kitchenette. They're doing a taco night tonight actually for kids. A room with computers where the kids can do like podcasts and things like that with videos. It was just very inspiring to be there and see everything. They've had over 230 visits since they've opened March 1st. They have 80 children who are non-duplicated. So he's happy with that. Just hearing some of the success stories from the students, or not necessarily students, but the youth in the community that they've met with. It's going very positively. The kids do sign in and out of the program. The hours have been adjusted based on the need. Originally, it was open 3 to 10 and then noon to 5 on weekends. Right now, the hours have been adjusted Tuesday through Friday, 3 to 8. There's adult supervision at all times. And the program does seem to be going really well.
I'd like to move the table. And am I out of order by what I'm asking?
What she said.
He wants to move to table it.
And can I explain why, Madam Chairman?
This is not a resolution, though. It's not a resolution.
This is a resolution.
Yeah, but I'm reintroducing the resolution after we have tabled it for 6 months.
Okay.
But it hasn't-
But it hasn't been moved or seconded yet, Lydia, so
Yeah.
you can't table it till it's been moved and seconded. And then you'd have to get a vote for the table.
Can I move for discussion?
You gotta vote.
Can I get a motion and a second for entering into a contract with HELPRA Inc.?
You've got a first with Lydia, I'll second it.
Okay. All right, now we can open it up for discussion.
Thank you. I really do appreciate this cause. I appreciate what Mr. Myers and his team has done. My issue is not that. My concern is that we have a youth bureau that is just beginning again, that a lot of work went into to get it started, and that a lot went into in acquiring the $250,000 ARPA funds. And before really getting a solid kickoff to, and don't get me wrong, Deb, you've done an amazing job. We have a great group who are doing things together, but we don't have a larger perspective as to what we're going to do with the ARPA funds yet. And to give 12% of that, or commit to give 12% of that away at this point, I think is premature.
30,000, you're thinking the $30,000 give is 12% of the 250,000 we have? I
Correct.
can't do math. Is that true?
Well, if it were 300,000, it would be 10%.
Okay,
So it's a 12% ask of our total ARPA funds for the Youth Bureau, which once these funds are gone, they're gone.
The funds, just as a reminder, the funds do have to be committed by 2024.
So
And this is, the $30,000 is a 2-year commitment?
It's for
23 to 25?
Rents. Mhm.
So Lydia wanted to table. You need a second to table and a vote.
Well, just- It's on the table for discussion at the moment.
Right, I mean, the next phase is,
Are you moving to table as well? 'Cause you haven't
Yes,
said-
you may please.
We have a second on that table?
it's defeated. So now you can vote.
Okay, can we get a motion? Can we get a vote on the resolution?
I have another.
Okay,
So, so this is covering the rent. I know at the time when we went over this months ago, the sheriff had some input in this, if we gotten a restatement about what his concern is with this, or how he's feeling about this now. I was just interested.
it was my understanding that there have been at least 2 conversations between the sheriff and Mr. Meyer. Brian had gone out and met the board of directors and had attended one of the board meetings. I think he visited the space. Some of the concerns from my point of view that I'm hearing is that the fact that there is an that it is a not-for-profit, it has, supervision at all times it's open. He was comfortable with the individuals on the board. I don't know if Wally asked Brian to be a board member, and I don't know the status of that. But it was my understanding that the initial reservations were certainly, a lot of them were addressed.
Great. So I guess from where I stand, and I had heard some of this prior to this resolution coming back, I understand what Lydia is saying about, really kicking off our own youth bureau and coming up with some programs and doing that work. I do think there's a need right now in the community. He's filling this need. So I think we give him some security with a space for, a 2-year, rental, that I think that's okay to commit to that. And then at the same time, continue long-term planning for whatever other programs come out of the Bureau committee. So I would support this.
To Lydia's point, the only other ARPA funds of the 250 that you've expended is the 10,000 to play space?
Yes.
Okay, so
So if this passed, then 40,000 of the 250 would have been spent, leaving us a balance of 210.
And this is 15,000 a year for 2 years.
okay.
Vote.
All in favor of this resolution?
Aye.
Any opposed?
I'm opposed, and I'm going to encourage others to oppose it when it comes to the full ledge. And again, not because of the program, but because of the limited funding that the Youth Bureau has going forward. This is not money that we'll be getting again, and this is not how I believe this was scoped for us when we brought this back. Thank you.
Yes.
Can I make a suggestion? I'm not on this committee naturally, but when you bring this to the full ledge on the 22nd.
Yep.
Just a thought, if you bring the sheriff with and let him explain, because I know some people were going by 6 months ago
Okay.
with some opinions that were maybe changed now. If you could bring him and let him, if he will,
Okay.
discuss what his opinion is now, I think it'll go a long ways.
Okay.
Everybody in agreement with that? I think it'll help.
Perhaps even at Ways and Means.
Yeah,
Okay.
yeah, that's a good point. Next week, Wednesday, and then the 22nd.
Okay.
Just a thought. It's up to you, Deb. All right.
Did, before we adjourn, Lydia, you wanted to take 3-5 minutes to talk about an issue?
I do,
Oh,
and
I'm sorry.
I just had one quick.
Oh,
update.
Deb,
I'm
yeah,
sorry.
quick update. I'm sorry.
I just had one quick update. With my update on here, I did receive an update this afternoon in regards to the New York State Governor's Youth Council. The top 3 that were moved on to judging were, out of the 7 that we had, it was Ryan Mahoonick, Abby Del Favro, and Clara Newman. I was informed today that Ryan Mahoonick was selected as our representative for here in Cayuga County.
Great.
congratulations.
Has he been notified? Yes, the letter came today and I was copied on it, so.
Okay,
please
so the
inform today.
alternate.
Yep.
Okay, great, thank you.
Can you do me a favor? Can you send me those three names? I'd like
absolutely.
to send a letter from
Yeah, that's what I wanted to
Alleged
talk to you about. I think
congratulating
that
all
would be
three of
great.
them.
Okay.
If you would do
Yeah,
that.
absolutely.
Thank you.
All right, that's all. Thank you.
Thanks.
Thank you.
One addition
Yep.
to the discussion about the
Safe space?
ARPA fund. And that is looking at the 30,000, looking at the 80 non-duplicated youth to year to date or 6 months to date. That's $187 a year investment per youth. I think that's a good bang for the buck since he's working with the highest risk youth. Just wanted to mention that in terms of the math.
Okay.
That's yearly per youth, being open year round for 2 years, each youth $187. I don't think you can get a Y membership for that.
Heidi, may I also mention that this is limited to youth ages 13 to 17?
Right, high risk. And a program where there's no drop-in, there's no similar program countywide, actually, not just in the city.
I'm not arguing the program. What I am saying is we have a limited amount of funds. We all knew that when we started, and we do not have a big picture of the plan. And to spend 12% of it on this without a big picture on the plan, I believe is not part of what we had initially discussed.
Okay, Lydia, you're on.
All right, thank you. So shifting gears, Health and Human Services, we are very concerned about the health of our community. And currently we have a part of our community in Conquest that is facing solar fields being brought into their location. And this area is has 30% wetlands. Everybody in this area is on a well. There is no public water as an option. The concern is this: Jefferson County, and many of you are probably aware of this, hopefully aware of this. Jefferson County had solar fields, solar fields battery fires. And they were concerned not only about the air quality as a result, but the water quality, what is leaching into their wells, what won't be able to come out of the waters. Our governor is putting together a committee to see what that really looks like. But my concern is we don't know enough, and we could be putting our constituents in harm's way. Any solutions or help that we can give to this group, perhaps a stay, whatever, some answers, we need to be able to get creative before we end up with a similar situation right here in our county. Thank you.
The permitting process for the Conquest Solar Farm was conducted by the state and the Public Services Commission. That environmental study, as far as I know, has been completed because I believe the permit has been issued. So at this stage in the game, I mean, there's not much we can do as far as the permitting is concerned. That's been issued. I'm sure the developer is moving forward with the project. To address this particular issue, I'd have to look at, where we could present the issue and in what format. We're not in a position where we could ask the state to retract and revisit the issue based on this one event. So we're somewhat stuck in the position of, having to accept what the state has done. I haven't looked at the actual permit or what data they use to reach their conclusions or what protections they may have put in place. We just don't know. One other potential avenue would be typically with these kinds of projects, the developer will be asked to have a host, what's called a host community agreement, where they will fund local communities and try to take care of the, impacts that the project will have. This certainly would be one of those impacts. And we would have to talk to the town, I suppose, because they would be at the front lines of that, to the extent that there's a host community agreement that would help fund, the fire departments and things of that nature to address that issue. Those would be the only two options I can think of off the top of my head.
Can I ask a question? Heidi, what do you think about, are you going to bring this up at the full edge meeting? Do you know?
Lydia.
Or Lydia, I'm sorry. Are you going to bring this up at the full edge meeting? I've done that.
If I'm allowed to, yes.
And the reason I'm asking you is maybe we could have Riley here, because I know Riley talked about it with me. He studied what happened up in Lewis County. Is it possible, maybe if you want to do this, bring it up, to have Riley here to help explain what he's learned from Lewis County?
I would love that opportunity. I'll reach out to him. Thank you.
Great, okay, thanks. Sorry for the confusion.
Rich, was this Garnet, the beginning, the original name?
Yeah.
Yes.
That project.
Yes, that's massive,
Yes,
yes.
2,000 acres or something.
Controlled by the state of New York.
Yeah.
Yep.
The state
Intent.
done all of the permitting on that. There's a state siting board and things of that nature. And I'm sure that, I believe from what I did read on this, there were some local folks who participated in that process. There was a local group of residents. I also believe that the town was directly involved on that board, had the opportunity to speak to these kinds of issues.
Just a little caveat on it. Neil, that used to work for our EMO, I think everybody remembers Neil. He's in charge of their EMO up there now. He was in charge of that scene.
Oh, in Lewis?
Just so everybody knows, yeah.
Was it in Lewis County or Jefferson?
I think it was Lewis.
Really?
Yeah. It might have been Jefferson, but whatever county it was, he's in charge because he did a little speech, made a little speech.
Just have a quick question.
County.
I'm sorry?
This was Jefferson County.
Yeah, okay.
Do you happen to know, Rich, how many municipalities in this county have passed a moratorium on solar? Do you happen to know, like, it seemed like we heard about it for like a couple months there and then.
I don't. I haven't.
Just curious.
Yeah.
Doesn't section 10 do away with local moratoriums?
I believe that if the project qualifies under Article 10, it would basically divert from any local control. So yes.
Like solar, like Conquest.
Right. But Article 10 is based on the size of the project. The larger the project, the more likely you're going to go through Article 10. If it's a
And
smaller
the
project, then they
right.
do.
In the what?
The wattage, the
Yeah.
kilowatt.
So the bigger it is, the more likely that the local would have no jurisdiction. It would be a state. Yeah, okay.
Correct.
And unless I'm wrong, this is one of the biggest, if not the biggest in the state, right?
I believe so, yeah.
That's how big it is.
It's hard to conceive 2,000 acres.
Yeah, I know.
But it's hard to conceive.
Thanks, Lydia.
Thank you. All
Thank
right.
you, Madam Woman.
Yes, is there any further business? No? Okay, motion to adjourn, say it.
To adjourn.
Okay.
I think I thanked everybody but Mike. Thank you, Mike, for coming.
Yeah. Okay, thank you.
I couldn't get your attention.
Oh.
You were too busy
Talking.